Welcome back for another deep dive. Today, we're going to be talking about canine distemper virus, CDV, but with a little twist,
Ooh, I like twists.
Yeah, you submitted a case report from the Journal of Veterinary Diagnostic Investigation, and it details CDV in a vaccinated puppy.
Oh, very interesting. Vaccinated animals developing the disease they were immunized against. Always intriguing, to say the least. Definitely warrants a closer look.
For sure. So let's just jump right into the specifics of this case.
Okay.
This report centers around a 14-week-old puppy presented for a post-mortem examination.
All right. So let's start with the clinical presentation. Initially, the puppy was reported as healthy. It received its first vaccines at, the typical 7 weeks of age. But then at 10 weeks of age, it started exhibiting some signs, anorexia, lethargy, and fever.
Oh, so those non-specific signs that can be so frustrating to pinpoint early on.
Yeah, absolutely. But unfortunately, the puppy's condition continued to deteriorate.
Oh.
Yeah. A rash developed and then followed by mucopurulent nasal discharge. The neurological signs then started with some disorientation and dysphagia.
Dysphagia, so difficulty swallowing, always a concern.
Yeah, always a concern. And this progressed to muscle fasciculations, seizures, and then even right-sided ventral strabismus.
Wow.
Yeah. So the puppy's condition worsened, culminating in multiple seizures in a single day, ultimately leading to the decision for euthanasia.
Sad situation.
It is, yeah. Very sad. Now, during the postmortem exam, the vets observed some gross lesions of purulent catarrhal rhinitis and pulmonary edema.
Rhinitis, okay. Suggesting inflammation in those nasal passages. And pulmonary edema, the fluid buildup in the lungs, both consistent with those respiratory symptoms we were talking about.
Precisely. Then they took things a step further with the histopathology. So examining the tissues microscopically.
This is where things start to get really interesting.
Right. Indeed. So the lung tissue exhibited severe bronchointerstitial pneumonia. And under the microscope, they observed areas of necrosis, fibrin deposition, and a significant neutrophilic infiltrate.
Essentially telltale signs of inflammation and, a battle against infection.
Exactly, yeah. They also found inflammation in the nasal passages and the trachea, aligning with the rhinitis that we talked about.
Okay.
Now, the brain is where things took a little bit of an unexpected turn.
Oh, okay.
The report describes perivascular cuffs of IBA1 positive microglial cells.
So IBA1, just to clarify for our listeners, is a calcium-binding protein specifically found in microglia, which are, the resident macrophages of the central nervous system. So these perivascular cuffs, they're suggesting an inflammatory response within the brain.
Exactly. And to add to the brain findings, there were also occasional neutrophils within the choroid plexus.
Okay, and the choroid plexus, of course, being that network of capillaries responsible for producing cerebrospinal fluid. So neutrophils there are indicating that the inflammation is extending to the cerebrospinal fluid.
Yeah.
So at this stage, what is the working diagnosis? We've got pneumonia, inflammation in the respiratory tract, and signs of inflammation in the brain and cerebrospinal fluid. What are we thinking?
Well, given all of those findings, I think it's understandable that the initial considerations were septicemia or aspiration pneumonia.
Makes sense, especially with the presence of neutrophils in multiple tissues.
Precisely. However, and this is where the case really throws us for a loop.
Okay.
The typical histologic hallmarks of CDV were absent.
We're talking about those syncytial cells, viral inclusions, and that hallmark demyelinating leukoencephalitis, right?
Yes, exactly. None of those classic microscopic features were observed. And this is particularly intriguing considering the puppy's clinical presentation, which strongly suggested CDV.
So despite the lack of those classic CDV findings on histology, they decided to test for the virus anyway.
They did. And this is where things take another fascinating turn.
Right.
PCR testing performed on both lung and brain tissue was positive for CDV.
Now, that is unexpected. A positive CDV PCR test in a vaccinated puppy, but without the typical histologic signs. That begs the question, how do we reconcile these seemingly contradictory findings?
That's the crux of the matter. Let's delve a little further into the details.
Let's do it.
The cycle threshold values for the PCR were 22.1 for the lung sample and 25.3 for the brain sample.
So those CTEAT values, if I'm remembering correctly, reflect the amount of viral genetic material present. And lower CTEAT values indicate a higher viral load.
Precisely. So the lower CT value in the lungs suggests a higher concentration of CDV there compared to the brain.
Okay.
And this piece of information just adds another layer to the puzzle we're trying to solve here.
Absolutely. And to add another level of complexity, they even did immunohistochemistry.
Indeed, they did. And they detected CDV antigen within neurons and glial cells of the brain, providing further evidence for the presence of the virus despite this atypical histological presentation.
Okay, so let's pause here for a second. We got a vaccinated puppy who exhibited neurological signs consistent with CDV, but lacked the typical CDV lesions on histopathology. Yet PCR confirms the presence of CDV. And they even visualize the viral antigen. It's like all signs are pointing to CDV, but it's presenting in a very uncommon way.
Yeah, you've summed it up perfectly. This is what makes this case so unique and worthy of further investigation.
Right. And remember, we also have to factor in that bacteria, Staphylococcus pseudintermedius, was isolated from both the brain and lung.
An excellent point. The presence of this opportunistic bacteria suggests a secondary bacterial infection, which could have further muddled the clinical picture.
So we're dealing with CDV, unusual histopathology, and a secondary bacterial infection. Talk about a complicated case.
Oh, it is, but here's where it gets even more intriguing.
Okay, let's hear it.
Genetic analysis revealed that the CDV strain found in this puppy was a 99.9% match to the rock-borne strain.
The rock-borne strain. Now that is significant. This is the strain that's used in many live attenuated CDV vaccines.
Exactly, and that raises a very important question. Could the vaccine itself have played a role in this puppy's illness?
All right, now that's the million-dollar question. It seems almost counterintuitive, doesn't it? A vaccine that's designed to protect against a disease potentially contributing to its development.
It does seem paradoxical. But before we jump to conclusions, let's take a step back and delve into the intricacies of vaccine-associated CDV.
Sounds like we're about to head down an even deeper rabbit hole.
Indeed we are, and trust me, it's a fascinating journey. So we left off with this bombshell, this possibility of vaccine-associated CDV in this puppy. While uncommon, it's certainly not unheard of.
Yeah, okay, let's unpack this a bit more. How could a vaccine meant to protect against a virus potentially end up causing it? I mean, that just sounds kind of crazy, right?
Well, I think it's crucial to remember that we're dealing with a live attenuated vaccine in this case.
Right, meaning the vaccine contains a weakened version of the virus,
right,
intended to trigger the immune system without actually causing the full-blown disease.
Precisely. And while these live attenuated vaccines are generally very safe and very effective, there's always, a tiny, minuscule risk that the virus can undergo some changes within the host.
Changes? You mean like mutations?
Exactly.
Yeah.
So as the virus replicates within the body, errors can occur during the copying of its genetic material. Most of these errors are harmless, but occasionally they can lead to changes in the virus's behavior.
So it's almost like a game of genetic roulette, where a rare mutation could result in that weakened virus regaining some of its virulence.
Yeah, that's a good analogy. And in the case of the rock-borne strain, which is known to have a history of occasional reversion to virulence, this possibility becomes even more pertinent.
It's both fascinating and a bit unsettling to think about, isn't it?
It is. We're essentially using a modified virus to train the immune system, but there's always that slight chance it could sort of backfire.
Now, I know you mentioned earlier that vaccine-associated CDV is uncommon, but what are some of the factors that might increase that risk?
Well, one factor is the immune status of the animal. So if the animal's immune system is compromised for any reason, whether it's due to illness or stress or medications, it may not be able to fully control the replication of that vaccine virus.
Okay.
And this, in turn, could increase the chances of mutations and potential reversion to virulence.
So a weakened immune system could create a more permissive environment for the virus to, shall we say, reassert itself.
Exactly. And we know this puppy had a secondary bacterial infection, which certainly could have impacted its immune response.
Right, that Staphylococcus pseudintermedius we were talking about earlier.
Precisely. Another factor to consider is the presence of maternal antibodies.
So you mean the antibodies puppies get from their mother's milk, which provide them with that passive immunity in those early weeks?
Yes. While these maternal antibodies are crucial for protecting puppies early on, they can sometimes interfere with the effectiveness of vaccines.
So it's like a double-edged sword. Protecting them initially, but potentially hindering their own immune response to the vaccine.
Exactly. The timing of vaccination is crucial to avoid interference from those waning maternal antibodies. And of course, there's always the possibility of vaccine failure, where the vaccine simply doesn't elicit the desired immune response, even in a perfectly healthy animal.
It sounds like there's a really complex interplay of factors that could potentially contribute to vaccine-associated CDV.
Absolutely. And unraveling those factors in each individual case can be a real challenge.
But stepping back for a moment, the fact that this puppy lacked those typical CDV lesions, that's still a significant piece of this puzzle, right?
You're absolutely right. It challenges our understanding of how CDV presents and how we diagnose it. The absence of those hallmark features makes this case incredibly rare.
In fact, the report mentions this is only the second documented case of CDV without those characteristic lesions, and the first in a domestic dog.
Indeed. And this begs the question, could this atypical presentation be related to that potential vaccine strain reversion? Is this a new or evolving form of CDV?
Now that is the million-dollar question. Does this change how we think about CDV diagnostics?
It certainly highlights the limitations of relying solely on histopathology for diagnosis, especially in vaccinated animals.
So even if we don't see those classic lesions, CDV should still be on our radar, especially when the clinical signs align.
Absolutely. This case underscores the importance of a thorough diagnostic approach. So considering the animal's signalment, the history, the clinical signs, and the laboratory findings.
It seems like PCR testing played a really pivotal role in confirming the diagnosis in this case.
It did. PCR, which detects the virus's genetic material, is a highly sensitive and specific tool for diagnosing CDV, even in cases where the histopathology might be misleading.
So PCR could be considered like a crucial weapon in our diagnostic arsenal.
I'd say it's an invaluable tool, especially when dealing with atypical presentations of CDV.
Now, this case report was published in a veterinary neurology journal, so let's shift our focus a little bit to the neurological aspects of this. What are the implications for veterinary neurologists? Does this change how they might approach neurological cases in dogs?
This case, I think, serves as a stark reminder that CDV should always be considered as a differential diagnosis in dogs presenting with neurological signs, even if they've been vaccinated.
So it should be on the top of the list, not just an afterthought.
Precisely. The possibility of vaccine-associated CDV, especially with these atypical presentations, makes it crucial to maintain a high index of suspicion.
So a detailed history, including vaccination status, that's essential.
Absolutely. And if CDV is suspected, PCR testing should be, strongly considered, regardless of whether those typical histologic lesions are present or not.
This case really emphasizes a comprehensive approach to neurological diagnostics.
It does. And I think it also highlights the importance of ongoing research in veterinary neurology. We need to understand more about the pathogenesis of CDV, the factors that contribute to vaccine-associated disease, and the potential for these evolving viral strains.
It seems like we've only just, scratched the surface of this complex and intriguing virus.
We have, and this single case report has opened up a Pandora's box of questions that will undoubtedly drive future research and shape our understanding of CDV for years to come.
Wow, it's really amazing how this one case, this one puppy, has opened up so many avenues for discussion. It really underscores that intricate world of viruses and the challenges we face in vet med.
It does. It definitely does. And, it reminds us that even with our best efforts in vaccination and preventative care, we're still constantly learning and adapting in the face of these evolving pathogens.
This case report was particularly fascinating because it was published in a neurology journal. And it kind of got me thinking about, the broader implications for the field of veterinary neurology. So what does this case teach us about approaching neurological cases in dogs, especially those that might, present atypically?
It serves as a potent reminder that we can't afford to become complacent in our diagnostic approach.
Yeah.
Even with seemingly straightforward cases, there's always that potential for the unexpected.
So being flexible and adaptable in our thinking is critical.
Absolutely. We need to remain open to the possibility of these unusual presentations, especially when dealing with diseases like CDV, which, have the potential for variability and even vaccine-associated complications.
This case really emphasized the importance of that comprehensive approach, taking into account all aspects of the case, the history, the clinical signs, lab findings, not relying solely on one piece of the puzzle.
Precisely. And in this particular case, the PCR testing was truly invaluable in providing that definitive diagnosis, despite the absence of those classic histopathologic findings.
Yeah. It seems like PCR is becoming an increasingly important tool in vet neurology.
It is, especially as our understanding of viral diseases evolves and we recognize the potential for these atypical presentations and vaccine-related complexities.
Now, shifting gears a bit, let's talk about prevention. We've delved pretty deep into the potential risks associated with live attenuated vaccines. So does this case change our perspective on vaccination strategies for CDV at all?
Well, it's important to remember that this case represents a very, very rare scenario. The benefits of vaccination in terms of protecting countless dogs from CDV far outweigh the risks.
So we're not suggesting a wholesale abandonment of live attenuated vaccines or anything like that.
Absolutely not. However, this case does highlight the importance of, careful consideration when making vaccination decisions. Factors such as the animal's age, their health status, their potential exposure risk all come into play.
So kind of a personalized approach to vaccination, tailored to the individual animal's needs.
Precisely. And of course, ongoing communication between veterinarians and pet owners is crucial to ensure informed decision-making and address any concerns regarding vaccination.
Transparency and open dialogue are key.
Absolutely. And I think it's also important to emphasize that this case, shouldn't deter pet owners from vaccinating their dogs against CDV.
Yeah. It's more about being aware of those potential complexities and having open conversations with their vets to make those informed choices.
Exactly. Vaccination remains a cornerstone of preventative vet med.
Well said. This deep dive has been an incredible journey through the complexities of CDV. I mean, wow, we've explored the clinical presentation, the diagnostic challenges, the potential for vaccine-associated disease, and the implications for vet neurology. So what are some key takeaways that you'd like to, leave our listeners with today?
Well, first and foremost, CDV is a complex and ever-evolving disease. We need to remain vigilant, adaptable, and open to new discoveries. Second, PCR is a powerful tool in our diagnostic arsenal, especially when dealing with atypical presentations. And finally, even with rare occurrences like this case, the benefits of vaccination far outweigh the risks.
Those are excellent points. This case has certainly given us all a lot to ponder, and it really underscores the importance of ongoing research and open communication in vet med.
I agree. The more we learn about CDV, the better equipped we'll be to protect our canine companions from this potentially devastating disease.
Yeah, for sure. Well, this has been a really enlightening discussion. Thank you so much for sharing your expertise and insights with us today.
My pleasure. It's always a privilege to delve into these fascinating cases and explore the frontiers of vet neurology.
Absolutely. And to our listeners, we hope this deep dive has been as informative and thought-provoking for you as it has been for us. From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.